organization was created to prevent disease and to lead to community health. We do that by building the capacity of local leaders to solve their own problems, to lower chronic disease rates, to understand what works, and to create lasting change. We started with tobacco control, but now we're working on obesity, diabetes, asthma, all sorts of chronic diseases, which are the #1 killers in our country and the leading causes of healthcare costs. All of these diseases are highly preventable, and we're doing just that, preventing disease in communities throughout the nation. Our objective is to create healthy environments so that the healthy choice becomes the easy choice. We do that by producing easy-to-understand tools with strategies for every community. We want to touch everyday life, our food, air, water, playgrounds, schools. We want to be creative, and we want to help local communities be creative so that they can join forces together and just get the job done for long-term health. So often, problems are solved in a piecemeal fashion. So, for example, a health department doesn't talk to a land use agency. It doesn't talk to a transportation agency. None of them are talking to the housing agency or to the schools. But people don't live in these silos. They live in integrated, holistic communities. And that's what ChangeLab Solutions provides. We are efficient, effective. We create benefits for everyone. We design public policies that fix problems for entire integrated communities. ChangeLab Solutions uses what we call a health in all policies approach. This means we integrate health into land use planning, into transportation planning. What does housing have to do with health? It has a lot to do with health because we can prevent asthma if we have healthy housing. We try to approach the entire fabric of community life. We build the capacity of leaders to fix problems, to look for solutions that will have long-term benefits, that will solve problems for generations to come. We don't want short-term fixes. We want long-term results that will affect communities well into the future. When you work on prevention, it's often hard to measure success because you have to measure what you don't see: asthma admissions, cancer rates, isolated elders unable to leave their home. We do know that for every dollar invested in prevention, we save $5 in medical care costs. That is so important in this day and age. And we're beginning to measure the number of open playgrounds, the number of smoke-free homes and smoke-free communities, the number and quality of healthy food options, especially in low-income communities. We've been at this work on childhood obesity for a number of years, and we're seeing in the communities that we work most closely with, the lower obesity rates are taking hold. This gives us tremendous hope for the future. You know, sometimes we hear complaints about the nanny state, about government trying to control choices, but that's not how we think about our work at all. What we're working on is starting with a healthy baseline for communities, especially for children, to level the playing field so that everyone has a healthy option. People make their choices after that, but we start with health as the center. ChangeLab Solutions has helped to save $134 billion in medical care costs related to tobacco disease. Because of those savings, we've also reduced tobacco-related diseases by 25%. We are so proud of that work. We work in all 50 states, large cities, small towns, rural communities across this nation. We're also efficient because we have multiple effects from every intervention we work on. So if we work on obesity, maybe opening up playgrounds or increasing access to healthy foods, we're working on diabetes, heart disease, stroke prevention, asthma. We're working on social isolation, getting people out of their homes, helping people age in place. All of these things are wrapped into a single policy approach. It's efficient, it's effective, it works for entire communities. One of the challenges we face is getting mixed up in red state, blue state politics. We try to avoid that. We're looking for common sense solutions to complex situations. Everybody needs clean air. All kids need nutritious foods and safe playgrounds. We are looking for answers that actually work to prevent disease, and we're looking to build the capacity of communities to solve their own problems. Well, with additional resources, we would do additional innovation. I have some of the smartest staff in the country. They are so creative in solving problems for communities, and with additional resources, they would go to town to tailor our approach to what communities need. We are not in a one-size-fits-all world, and we really need to work with particular communities on exactly where they need to go to solve their problems. We also know that we have a long way to go in this country. It's taken us a few generations to create the health problems we're trying to solve today, and it's going to take us a few generations to move out of those problems into healthier communities. So, with additional funds, we'd keep going. We need the sustenance, the sustaining power to support communities for the years to come. In public health, we're just beginning to use the tools of law and policy to prevent disease in this country. We have so many challenges in front of us. We've got big cities, suburban communities, some small rural towns. Each have different needs. Here are some of the questions we're trying to figure out. How do we finance this work over the long term? How do we evaluate its success and create metrics so we know what's working? So there's lots of areas for future growth. But we always keep in mind reaching the most vulnerable communities, those with the least resources, the highest disease rates. These communities motivate our work and make our work so important for the future of children today.